Good day, everyone, and a warm welcome to all our listeners here in Radio Land. You are listening to Your Health Matters on Kaieteur Radio. I'm your host, Rihanna Ramsey, and today we have with us, we have a special program for you. We'll have a bit of call-in later where one of our sponsors is offering a giveaway on health products. But today we are talking about high blood pressure or hypertension, and we have with us Dr. Grace White, who is from the Georgetown Public Hospital. She is the senior registrar at the Department of Internal Medicine there, and she's here in studio with us to discuss our topic, which is hypertension or high blood pressure. Good afternoon, Dr. White. Welcome to the program. I know you're new here. We usually give our guests a chance to introduce themselves and get to know our audience. So go ahead and tell them about yourself and what you do there at Georgetown Hospital. So when they see you, they'll know that's Dr. White and what she does. So go ahead.
Good afternoon, Rihanna, and thanks for having me. It's certainly a pleasure to be here, especially to discuss with the viewers the very important topic of hypertension. Before I go further into discussing hypertension, my name is Dr. Grace White. I am a senior registrar in the Department of Internal Medicine, like you heard, at the Georgetown Public Hospital Corporation, and more specifically, I work at the Internal Medicine Clinic, where we see a lot of chronic diseases, including high blood pressure or hypertension.
Mm-hmm. Okay, so as we go into our discussion, you mentioned that there's certain a definition that comes along with this condition. So just give us a rundown of what, in medical terms, what is hypertension?
Sure. So hypertension, or high blood pressure as it is commonly called, refers to the condition in which the force of the blood against the walls of the blood vessels exceeds what is considered normal limits. And at this point, it has the potential to cause disease. So that's the definition. I know most people might want to ask, well, so what is considered normal? Generally, a blood pressure of over 140, that's the systolic, or what is called the top number. 140 and greater than 90 for the diastolic, which is called the bottom number. Most people say the top number and the bottom number. So blood pressures above 140 over 90 are considered to be in the hypertensive range.
Yes.
However, the American College of Cardiology, along with the American Heart Association, they have a staging system for hypertension. And normal is considered when the top number is less than 120 and the bottom number less than 80. Elevated is considered when the top number is 120 to 129 and the bottom number still less than 80. Stage 1 hypertension is when the top number is 130 to 139 and the bottom number is between 80 and 89. And then, of course, stage 2, which most people call hypertension or high blood pressure, is when that top number gets above 140 and the bottom number above or equal to 90.
So as we're on numbers, when is it when are we like in serious danger? Every now and then you have a spike, I believe. But when is it that we should be concerned when our pressure reaches a certain number or above that limit? When should we be concerned or go see a doctor or something like that?
Okay, sure. So there are various algorithms that we follow in terms of diagnosing hypertension. But as a general rule, if on repeated blood pressure readings you find a blood pressure above 135 for the top number and above 85 for the bottom number, you should begin to talk to your healthcare provider or the doctor at clinic, as we say.
And let's go into causes. What really would you say are some causes? Because we know there are risk factors like, if you have a family history of hypertension or high blood pressure, you might be at risk for this condition. But what are some of the others that are associated with this
Sure.
this illness?
Okay, so to answer that question, I must first let you know that hypertension can be considered in two categories. First, there is the essential hypertension, which is what we're accustomed to hearing almost everybody out there in society saying, oh, I got high blood pressure, hypertension. This essential hypertension is not specifically defined, has not specifically defined causes. It is thought to have genetic predisposition and then triggered by, or as you mentioned, the risk factors such as age. You know, the older age groups are associated with developing high blood pressure. But mind you, in recent times, because of our lifestyle changes, we have been seeing high blood pressure in younger and younger age groups. Then there is obesity, diets that are high in salt and fats. And then there are certain disease conditions that can cause high blood pressure, such as kidney disease, or some endocrine or hormonal diseases. Those are associated with hypertension.
And when it comes to, you said it's happening younger and younger. Can you say what is like the youngest, like who, what's like the age group, and what are like, who's the youngest person, or what is the youngest age that you can have that condition?
All right, again, we have to look at essential versus hypertension with secondary causes. Hypertension with secondary causes, that's where the high blood pressure is due to some disease condition that can occur in children, in persons as young as in their childhood years.
Childhood, can you put an age to it?
Any age at childhood, 5, 9. It just depends on if they have that condition. For instance, there's some kidney conditions like what is called the nephritic syndrome. These conditions are associated with high blood pressure. So this is not the essential high blood pressure that is common in society. This is high blood pressure that is associated or connected with another disease. And there are some childhood illnesses, such as the one I mentioned, nephritic syndrome, which can render that child hypertensive or that young person hypertensive. However, the more common form of hypertension, called the essential hypertension, that is usually found in persons above 40 years. But again, we have been seeing a tendency for younger age groups to present with what we might consider essential hypertension, where we're not finding any secondary cause. And this we believe to be due to the fact that we have adopted more and more Western lifestyles. Our diets have changed. We have become more sedentary, with everyone driving and more elevators, so no one using the stairs. Cigarette smoking is another very important risk factor. Yes.
And in terms of treatment, and well, we're going to talk about monitoring a little later because it will tie into what we're dealing with on the show. We have some sponsors who are coming on later on in the show to talk about a type of monitoring equipment or testing equipment. So we're going to talk about that later. And those who are our regular listeners, it would be nice if you can tune in and call in and answer some questions so you can get to probably get a chance to win one of the giveaways. But let's go on with our discussion. And one of the things I want to know is treatment. And we know you talked about diet. What are some salt products that we should definitely avoid? Because salt, when people hear salt, they just think salt that you put in food, but it's more than just salt. Cube, is cube safe?
Okay, so that's a very good question, and I'm happy that you asked it, because indeed we'd say to people, don't eat this or don't eat that, and sometimes we forget to say, well, what can you eat, or what is safe?
What's the substitute?
Yeah, what's the safe zone? So when it comes to salt, actually, to be very strict, or the allowed salt limit for adults is just 1 teaspoon per day. Now, this is very difficult to achieve because almost everything we eat has a salt content, even fresh vegetables, they have their own salt content. This 1 teaspoon per day renders to our body about 2.4 grams of sodium. And it's the sodium that is in salt that is really the chemical or the factor that we need to monitor when it comes to high blood pressure. So a good guide would be if you can avoid adding salt to your food and use more, of the natural spices, the herbs, garlic, onion, shallot, those things that can flavor your food, that would be great. Where it comes to cube, as you specifically asked, we must let our listeners know that both cubes and aji, because some people say, oh, I'm not using aji anymore, I'm using cube, but both cubes and aji have what is called monosodium glutamate in it, which adds sodium to your food as well. So we advise our patients, especially the hypertensive patients, to avoid both the cube and the aji. I know that recently there have been some patients that are saying they have found no salt cubes. So I guess that's allowed if there's no sodium cubes, and that helps your food to be a little more palatable for you, then certainly that's allowed.
Just before we go to break, I touched on treatment. You can probably speak more to that. Like, what are some of the medication or tablets? I don't know. What are some of the stuff that a person who is hypertensive or is dealing with high blood pressure can use to keep their pressure under control?
Sure. Even as I attempt to answer that question, I'll ask your permission if I could back up a little bit more to the risk factors, because there is a connection. When you asked about risk factors, I should have let you know that they are considered again on the two categories. They're the non-modifiable risk factors, which are the ones that I mentioned, such as the genetic factors,
can't
age,
change that,
sex, those that cannot be changed. And then they're the modifiable risk factors. All right? So as we approach treatment, we look at it as the non-pharmacological approaches and the pharmacological approaches. Those non-pharmacological approaches are those lifestyle modifications that can be made that help to modify the risk factors. All right? So we will talk about diet as probably the top one and the most important, where we advocate healthy diets. And there are some specific things that are incorporated into a healthy diet, but in a general sense, I would say it's a diet that's low in fats, salt, and sugars, or when I say sugars, I mean carbohydrates, and high in fruits and vegetables and fibers. That's just the general rule. Also, we ask for physical exercise. All right? If we could park the car and walk a little bit. What we recommend is at least 30 minutes for at least 5 days of the week. Or, depending on your lifestyle and the time available to you, if you could make that 150 minutes per week, it's recommendable. Of course, you can discuss with your healthcare provider what forms of exercise and how much exercise is suitable for you. But as a general rule, 150 minutes per week. And then we ask for limitation to alcohol use and cessation of smoking. Why limitation and cessation? Well, there are no safe limits for cigarette smoking. We would say limit alcohol use, but we ask for persons absolutely to quit smoking. And of course, I know that's difficult to do, but if you need help, there are resources.
Well, you'll touch a little bit on that as we continue. Some of the resources that they can probably tap into if that's under your purview. All right, we'll just go to a short break, and when we come back, you'll hear more from Dr. White. We're talking about managing your high blood pressure or hypertension.
You're constantly exposed to viruses and bacteria every day. That's why you should take Redoxin Double Action. Its formula of vitamin C plus zinc strengthens your body's defenses to fight diseases caused by virus, bacteria, and minor infections. Take Redoxin Double Action every day. It's from Bayer.
Kaieteur Radio, keeping you informed.
Demerara and Essequibo 99.1 FM.
Burby's 99.5 FM. Kaieteur Radio.
Welcome back to the program. You're listening to Your Health Matters here on Kaieteur Radio. I have with me Dr. Grace White. She is from the Georgetown Public Hospital, and she's talking to us about managing your high blood pressure. For those who are listening and joining us via Facebook Live, we have a call-in program later after the discussion, and we're going to give you a chance to win a couple of hampers. So please stay with us. And we'll see how much you've been learning or listening as we go along. Dr. White has been telling us a little bit about some of the specifics to this condition, which is hypertension. And now we're going to ask her to tell us some of the other health issues that would be associated with having high blood pressure. So go ahead, Dr. White.
Okay. Thanks again, Rihanna. Health problems associated with high blood pressure. High blood pressure, I must say, is the major risk factor for cardiovascular disease. And when I say cardiovascular disease, I'm referring mainly to stroke and heart attack. It's also associated with the development of heart failure and kidney disease. High blood pressure could also be attributed to some eye damage as well. So I think these are the major health conditions for which high blood pressure, hypertension can be considered a risk factor. Cardiovascular disease, which in fact is Guyana's top killer, number one killer, and when I say cardiovascular disease, I'm combining stroke, which is cerebrovascular disease, and heart attack.
Wow.
Those are our major killers. But hypertensive disease itself is considered like number 5 in terms of mortality causes in Guyana.
And when somebody is dealing with hypertension and other compound health issues that compound their situation, how do you advise them? How do you treat that patient so as to keep their risk of fatality low, or keep them at a state where they can have a normal, at least a life that can, be progressive despite what they're dealing with health-wise?
Exactly. That's a tremendous question. Again, non-pharmacological and pharmacological approaches. So for persons who are hypertensive with comorbidities, or even just hypertensive alone, or hypertensive and dealing with some of the complications that have developed from your high blood pressure, the most important thing is to adhere to your lifestyle changes. Ensure that you adhere to your diet, rich in fresh fruits and vegetables, low in salt, fats, and carbohydrates. Ensure that you gain an adequate amount of exercise, which in a general sense tends to be about 150 minutes per week. A brisk walk would be considered healthy. But of course, like I said, you can discuss with your doctor what is best for you. If you have the habit of smoking, try very hard to get off of cigarettes and limit alcohol intake. And the pharmacological treatment, extremely important that you do not miss your medications. So let me deal with a typical fallacy that is out there, which is, well, when the pressure high, or if my reading showing low, I mustn't take my tablets. No. Never stop using your treatment, or don't change your medication without the advice of your doctor. Continue using your medication as prescribed, unless you are sick and when you test your blood pressure you see an extremely low blood pressure, you know that something has gone wrong, then contact your doctor right away. But if you see a normal blood pressure reading, don't take it as a cue to stop your medication. It's the medication that is helping your pressure to remain normal, and it's very important to maintain constant normal levels. The fluctuations that go with not using medication regularly are very damaging. So that's very important. Use your medication as prescribed. Keep your clinic visits and don't share medications.
We have an issue with that,
Yes.
sharing medication. Because of our culture, people tend to say, oh, I run out of tablets. Let me see if my neighbor who has the same condition. But sometimes, as you said, that is not the same tablets. And even though it might work for some time, it can cause some complications, right?
Yes.
Because you're a different individual, and everybody what would be good for you might not be good for me. So based on our own makeup and our own risk factors, maybe I'm dealing with the hypertension that comes from what's called genetics, and you're dealing with something that caused your hypertension. So you have to be careful not to share medication, and I believe Dr. White would agree with me.
Yes, very, very true. And in addition to all that you've said, Rihanna, sharing your medication also means that you're limiting or lessening your quantity,
Yes,
your
true.
dose. You're likely to run out before your clinic date. And within those 1, 2, or 3 days that you miss your meds, your blood pressures can rise to dangerous levels. So please, let's adhere to our medications as prescribed.
And in terms of we're talking about, as we're on the topic of medication, you mentioned smoking and so on and risk factor. We're going to
Yes.
touch on that return to that in a bit. But you mentioned, as you're talking about medication, could you say, are there side effects to some blood pressure medications?
Of course. Almost every drug has some adverse effect, and the same is true for medications made for high blood pressure. Some of the more common side effects would be, and each class of drug, let me say, may be associated with a particular side effect. However, I must hasten to say that these side effects are extremely rare and are reported in the package because it is mandatory. It's only right that the manufacturers let us know what might happen. But the side effects are usually very rare, especially the serious side effects. However, some of the common side effects associated with the commonly used drugs, those that end in pril, a lot of you might be using ramipril, enalapril. Some of you may have been given captopril at some point in time. So those that end with the prils tend to have what is referred to as, you may have some allergic reactions, such as a skin rash, and very commonly a cough, a very annoying cough. If that's happening to you, you should let your doctor know so that you can put on another class of drug. Most likely, the doctor will put you on a class which is a cousin to the prils, and those are the sartans, the losartan, and so on. So that's one of the common ones. Another common feature with amlodipine, a lot of persons might be familiar with that term, amlodipine, is swelling to the legs. Right? So those are some of the common causes, common side effects of the medications. But again, please do not stay away from using your medications for fear of the side effects. Discuss this with your doctor. And
Always
if
good.
you believe that some adverse reaction has occurred when you started your medication, discuss it with your doctor so that you can be put on a suitable substitute.
And we know that, as you said, most medication, there are side effects, but there are actually some drugs that cause hypertension. Tell us a bit about that.
Okay, so there are many commonly caused drugs, commonly used drugs that can result
And these
in
are
hypertension.
over-the-counter drugs.
The most typical of the over-counter drugs that can contribute to high blood pressure would be what we call the cold medicines. They contain ingredients which can affect blood pressure regulation, such as increasing the heart rate. All right? And there are also some drugs that are used for pain medications, such as the NSAIDs, which are non-steroidal anti-inflammatory drugs. Those are like the ibuprofen and the Voltaren. They too can contribute to elevations in blood pressure, especially for hypertensive persons. Another common drug would be the oral contraceptive pills.
Wow.
They too might result in hormonal fluctuations that can contribute to high blood pressure.
Okay. Well, I hope those who are listening got that bit, because we have a tendency of just going to the pharmacy and buying drugs that we think, okay, is giving us a short-term relief from pain or whatever it is. But those drugs also can cause long-term issues, which is like hypertension and probably other domino effect, because we know hypertension can result in stroke and other things. You mentioned earlier about smoking, and you said that there are ways in which you can deal with that. Smoking is not easy to overcome, because smoking is something that can compound your issue if you're dealing with hypertension or any NCD, which is a non-communicable disease. Tell us a bit about, in your estimation or your views, how persons could deal with drinking, or if they have these issues and you know that they're dealing with hypertension and they're not supposed to be doing it. So as a doctor who's working in the system, tell us where they can get some help in terms of
Sure. Another very important question. So for all the risk factors of hypertension, there are resources that can be accessed to help someone who may be struggling. For instance, persons struggling with alcohol and illicit drug addictions. There are counseling services available at the Georgetown Hospital psychiatric unit, and persons can be referred there by their health center to access those services. For smoking, we can post later on places where you can access help, but you can start by discussing with your primary provider or the doctor at your health center ways that you can help yourself to get off the habit. Counseling goes a far way, but there are also some products that are advocated. Again, you should not take a product before talking with your doctor, and these include things like the nicotine patch, the gums, certain tablets, which can assist you, but depending on your condition, you need to discuss with your doctor whether that's the right product for you. Where it comes even to diet, some people do have a very big problem. We tend to focus on the alcoholics or persons addicted to cigarettes, but diet is a big one as well. Most of us have difficulties with being disciplined with our diets, and there too, there are resources that can help. Your counselors, nutritionists, dietitians. Georgetown Hospital does have that service that we utilize at the clinic, where we refer our patients to not only a dietitian but a nutrition educator who can actually walk with you through whatever is your challenge in maintaining a healthy diet. For some persons, it might just be that they have such a busy lifestyle that it is difficult, or in their perception, it is difficult to prepare healthy meals. For some persons, it's their budget issues. There is a perception that healthy eating is expensive eating, but that is not necessarily the case. So, yes, again, there's counseling available for you if you are particularly challenged in this area.
Okay. Thank you so much for that response, because people tend to think that, okay, it's only the medication that is available in the health sector or medically. But no, we have other services that would be able to help guide you through what you're dealing with, because we know that illness or sicknesses don't just come with physical attributes. They tend to have psychological effects as well. And we in the health sector, they try to address all these issues as a whole, so that when you're well, you're a whole person. You just don't get well physically and then you have the mental issues to deal with. So they try to counsel you and get you on the right track, so that you don't have to deal with smoking, and you're dealing with the urge and you don't know what to do. So as we are on the topic and talking about the wholeness, we're dealing with the pandemic, and I know that you have some of your patients who are hypertensive wouldn't want to get vaccinated or immunized. We're still dealing with some of that, right? So tell us a little bit about your experience in that part, and then we're going to go into a little bit about monitoring and the importance of monitoring when you're dealing with hypertension, because we're going to have some special guests from the Cinco Limited, and they're going to be talking to us about a new product that they have to offer. So let's talk about COVID-19 and those persons who are a little bit skeptical of taking the vaccine because they say, my heart rate going to go up, or stuff going to happen to me if I take the vaccine. Tell me about the experience of your patients who have taken the vaccine, and how you would encourage those who haven't.
Sure. So we've had patients with varying responses. But from the outset, I would like to say what I normally say is that your high blood pressure or whatever chronic condition you might be dealing with is not a reason not to take the vaccine. Rather, it is the reason why you should take the vaccine, because the vaccine is another layer in protecting yourself against contracting the COVID-19 disease. And it has been found that persons with hypertension in particular and other chronic comorbid conditions have done poorly or have the worst outcomes if they ever contract COVID-19. Responses from patients vary, and it's very funny how human beings respond. And we as physicians must always remain sensitive to the fact that, yes, COVID-19 is new, and there are lots of fears and myths and theories out there that have impacted the population and caused various ideas to be spinning around. So there are some persons who actually come requesting to be vaccinated or wanting the doctor to give them clearance, as they say, so that they can get their vaccine. Mm-hmm. Yet on the other hand, there are those who fear that their comorbid conditions render them susceptible to some risk from the vaccine. So patients' responses have been varied, but many of our patients have taken the vaccine with no ill effects. And so again, it has been shown that any risks associated with the vaccine, the risk of COVID-19 or the morbidity, the sickness, the deaths, the devastation caused by COVID-19 far outweighs any risks that the vaccine may present.
Mm-hmm. And so as we're going to talk about monitoring a bit later, but somebody asked a question about, because I encourage my viewers and listeners to ask questions, and they asked a question about stress level. How can a person who's hypertensive effectively manage stress? How would you recommend they go about that management of their stress level, especially if they're working in a stressful environment, or they're exposed to some kind of stress level, dangerous stress level at home? How do you recommend that?
Sure. Mm-hmm. So each individual deals with stress differently. Mm-hmm. And it is recommended for all of us, all persons, to learn how to manage stress. We all have different levels of stress, different causative factors in our lives that cause stress. And it is important for each person to develop that coping mechanism and that ability to manage stress. There are certain techniques that are taught. People are taught various relaxation techniques. counseling again helps. If you are if you're facing an issue that is particularly stressful to you, it is recommended that you don't carry that burden alone, but find someone that you trust and that you can look up to, especially someone that has some amount of knowledge or expertise in dealing with the issue that you're facing. Find someone to talk to. Also, it is advised to also find a peer group. People tend to cope better when they talk with persons who have similar situations or are going through similar issues. So take, for instance, even in chronic diseases, there's certain diabetic peer groups, or different conditions have peer groups that you can talk with and bounce ideas off of each other as how to get rid of that stress. And simple exercise. We spoke about exercise before in terms of what it does to lower, to help in managing blood pressure. But exercise is also associated with lowering stress levels because of the endorphins and other hormones that are released when someone exercises that can help with dealing with stress.
And we're going into monitoring now. Most people try to monitor. This is a condition that monitoring is essential. So you're going to touch on that a little bit, and then we'll go to a short break. And when we come back, then we'll have our special guests who are joining us virtually, and they'll be talking to us about this new product that is essential to basically monitoring blood pressure. So go ahead, Dr. White, tell us a bit about monitoring and why it's important to monitor your blood pressure, and how often should you check it?
Okay, sure. So monitoring should begin even before someone is diagnosed with high blood pressure. This is called screening. I think one of the problems with our society and our culture is that persons don't like visiting the doctor or getting close to anything to do with health and medicine. So they feel they're healthier the further they stay away from any medical instrument. But it is recommended that adults who have not been diagnosed with high blood pressure and who upon first testing have been found to have normal blood pressures, it is recommended that they repeat that test at least every 3 to 5 years. These are individuals younger than 40 who have no risk factors for high blood pressure and who upon initial testing have been found to have normal pressures. And this is the recommendation of the American Association of Family Physicians. For persons who are over 40.
And this would be screening. This would be not the regular where you have a monitor at home and you're checking. This would be screening.
Yes, but it can be done at home preferably. But yes, it's called screening because now we're dealing with persons who are not yet diagnosed. Okay, there's a lot of hypertension hiding in the community that has not been diagnosed. So for persons less than 40 without other risk factors for hypertension and who on some initial measurement have been found to be normal, that those persons are asked to repeat at least 3 to 5 years. For persons above 40, persons with risk factors, they're asked to have a test done at least once per year. However, from our experience here in Guyana and the fact that hypertension is so prevalent in our community, I would suggest that even twice a year would be suitable or favorable. And this is for persons who on their initial reading were found to have a normal blood pressure. For persons who have been diagnosed with high blood pressure, in our setting, their pressure readings are done at least every 3 months when they come back to clinic, and they are given cards so that they can have their blood pressure monitored at home. Sometimes, depending on how their control is, we ask them to do it once per day.
And they will have these monitors, these what do you call it, pressure machines.
So yes, the blood pressure monitor at home, we prefer the arm monitor rather than the wrist monitor. But yes, they can have it at home or they can have it done at the health center.
All right. So thank you so much, Dr. White. We're going to go to a short break, and when we come back, we're opening the phone lines for some questions to be answered, and you will have a chance to win some prizes. So some surprise. So we have two guests joining us when we come back virtually. Thank you so much, Dr. White, for taking time to beat the traffic to come here into the studio to talk to us about high blood pressure. We will hope that you would come back some other time and talk to us more about other NCDs and so on. So thanks for being here with us, and just stay on the line, viewers and listeners, and we'll be back in a short bit.
You're most welcome.
Kaieteur Radio, keeping you informed.
Demerara and Essequibo 99.1 FM.
Burby's 99.5 FM. Kaieteur Radio.
Good afternoon and welcome back to Your Health Matters here on Kaieteur Radio. For those listening and who were joining us from the beginning of the program, we announced that we'll have a call-in, something that we don't usually do. We have two special guest pharmacists from the Cinco Trade-In. They're one of our sponsors here, and they are going to be talking to you about something that is relevant to our topic, which is hypertension and high blood pressure. Their names are Miss Sarah Peggott and Miss Candace Lamb. Is that it?
Yeah, Candace Lamb. Good
Candace.
morning. Good afternoon.
Good afternoon.
Hello.
And
can you hear us?
Yes, I can.
Okay.
So for those who, they're going to tell us about a new product that they're promoting today, and it's something that is relevant to monitoring your blood pressure. Ms. Pickett, I'll ask you to talk about it in a bit, and I'll give you the phone numbers that you could call in to answer the questions, because they're going to have questions for you. So if you keep listening, you will have a chance of winning a hamper. The number is 226-7453. And if you dial that number after they finish sharing what the product is, you will be able to win a hamper. So go ahead, Ms. Pickett.
Good afternoon, Rihanna. Very, very informative session with Dr. White. I really enjoyed it. And today we would like to talk a little bit more or add to your program by sharing one of the products distributed from the Cinco Limited. Mm-hmm. So a lot of persons are familiar with the Cinco being consumer good products and home items, decorations, but we've actually expanded into a health and wellness division, where we actually distribute the Redoxon and the Redoxon Double Action, Aleve Natel from Bayer portfolio. But in particular today, one of the key things that we're talking about is Omron. In particular, Omron blood pressure monitors. Mm-hmm. So Dr. White would have mentioned the importance of keeping check and screening of your blood pressure readings. Mm-hmm. Whether you have a history of hypertension or whether you are diagnosed as a hypertensive patient, it is very, very important for you to keep a check of your blood pressure levels very regularly. Mm-hmm. So The Omron actually is a home blood pressure monitoring system, kit, and it is essential in preventing heart attacks or heart diseases and strokes, basically. The Omron brand has over 40 years of reliability and accuracy, and it is actually the number one doctor and pharmacist recommended brand in the United States. We currently distribute three products or three types of the monitors. We have the 3 series upper arm monitor, we have the 5 series upper arm monitor, and we have the 5 series wrist monitor that we have available and is distributed nationwide. Just wanted to add that one of the main reasons I think Dr. White would have mentioned that, you know, it's important or it's more comfortable, she mentioned preferably at home to monitor, is that sometimes persons have a white coat syndrome where they get scared by the thought of having to go to the doctor. So therefore their blood pressure levels might be elevated when they go to the actual doctor. So it's more comfortable, and of course it's more convenient to be able to monitor your pressure at home, and that's where the Omron blood pressure monitors come in. Right now, especially with the rainy season and especially with the pandemic, there's actually a study that is published in the Journal of the American Heart Association as of November 23rd of this year. And it indicates that there's actually a national health alert that there's an increased risk that a bout with a seasonal flu can have an adult with high blood pressure and other health conditions with increased heart disease. So especially with this rainy season and the pandemic right now, which have flu-like symptoms, if you suffer from cardiac diseases and if you suffer from high blood pressure and you would have experienced a bout of these conditions, you have an increased risk of having spikes in or elevations in your cardiac conditions. So it's very, very important to keep a check on your blood pressure on your blood pressure levels. And the Omron blood pressure monitor is the number one in the world for you to be able to do that. It's very easy to use. Once you attach it properly to your upper arm or your wrist area, the press of a button and you will be able to get your reading. It will indicate to you if you have, if it's slightly elevated. They have symbols for that on the monitor itself. And the monitors actually have 60 to at least 60 readings, 14 to 60 memory readings on the machine. So if it's a case where you might not remember to write it down for the last 2 days, because you're supposed to have a notebook also to record your readings, you can just check back. It will tell you the date and the reading that you have.
So that's basically in a little protractive summary what you're offering, and that's available. This product is available at the Cinco Trading. Tell us a bit about your locations and where they can go, how they can get it, and if there's a number that they can call, and then we'll go into your question and answer segment.
Okay, so the monitor is actually available at the Cinco Industrial Site Echoes, the Cinco Limited, or you can pick it up or purchase it at the Cinco Cash and Carry on Sherry Street. It is also available at pharmacies nationwide, Massey Pharmacies, Providence, Megastore, Runveld, Medicine Chest Pharmacy, Medicare Pharmacies, Sachi Pharmacy in Essequibo, and Punai's Pharmacy in Rose Hall, Berbice. So it's widely available. As I said, it's very convenient, and we're trying to ensure that persons help get their blood pressure under control, and one of the ways to do that is keeping a regular check on it.
All right, so I'll give you a chance. For those who are listening to us, we're opening the phone lines. The number is 226 7453, and you can answer some questions. So go ahead, Ms. Piggott, Sarah Piggott. She's talking. She's from the Cinco Trading, and she will be. And Ms. Lam, I see you want to say something.
Hi, Rihanna. Yes, I just wanted to add to what Sarah is saying. So aside from what we spoke of with good quality BP monitoring and ensuring that you have a good quality machine that would outlive the life. So a lot of people look at an option where they can buy a cheaper blood pressure monitor.
Yes.
But then it's not accurate and it's faulty. So with Omron, we can guarantee you it outlives its life. It's worth every penny that you're going to pay for it, and there is no inaccurate readings.
And it actually has a warranty on it from the manufacturer.
Yes.
Okay. And
So it's really, really worth it to go and get the Omron versus any other generic brand you might have heard about or have seen about in other pharmacies and around the place. And to also add, aside from what Sarah mentioned earlier, we're also the distributors for AstraZeneca medicines in Guyana. Now, AstraZeneca is internationally recognized. Most people would have heard of the AstraZeneca vaccine. So it's one and the same company, but there is also an entire pharmaceutical range with AstraZeneca where you can get different BP, blood pressure medications, as well as cardiovascular, renal, and so on. So what I just wanted to add to is what people don't realize and put focus on is that there is a lot of ineffective and poor quality medicines available in Guyana. So substandard medicines. So you might think you're going to a pharmacy and you're buying a good quality medicine, and that's usually not the case sometimes. So that's a big thing to focus on. And I would have listened earlier and heard Dr. White mention quite a few examples of blood pressure medications people can purchase and look for with varying side effects. So I just want to point out that they also have to ensure that they're getting a good quality medicine and it's an original brand. So poor quality medicines would affect the person's blood pressure, whereby if they're using an inferior product, it can also not work for the person. So they'll be taking 1, 2, 3 tablets and they're not seeing any increase or any
any regularization of
their blood pressure.
levels.
yes.
So they just have to ensure good quality medications, and if they're looking for a brand, that they ensure that the brand is not, for example, a Turkey brand, which is inferior. Ensure that your medications are printed in English. Good quality medications always have English translations. So if you're not seeing in English, then you really have to be worried about inferior products and medications.
Okay, so for those listening, so you brought in a very important point about having proper the quality, the good quality medication.
Yes.
So I just wanted to let you go into your questions because we're pressed for time. And
all right.
So we'll just go into the questions where persons can call in and answer. The number is 226-7453, and Miss Piggott and Miss Lamb will be asking some questions. And if you have been following the program, you can probably call in and win something from the Cinco Limited. And the Cinco Limited is the authorized dealer for this Omron product.
Correct. We are the authorized distributors for the Omron blood pressure machines. Yes.
Yes. So go ahead, Miss.
So it's two very simple questions, and it's you can pick up the small hampers at this cash and carry on Sherry Street. The first question is, name one type of the Omron blood pressure monitor distributed by the Cinco Limited. And the second question is, name one location other than the Cinco Limited where you can purchase an Omron blood pressure monitor. So two very simple questions. We would have mentioned the information before. So
go ahead.
If you have the answers.
I'll ask my operator to open the phone line. So you can call in. The number is 226-7453. And we'll be waiting a bit. So go ahead. Caller is on the line. Good afternoon.
Good afternoon.
Hi, good afternoon. Thank you for listening. I'm so happy to hear our caller. This is my first call-in program, actually. Thank you, Cinco. So go ahead, answer the question. Hello? We had a problem there.
Hi, hello?
Hello? Hello?
Hi, good afternoon.
Good afternoon.
I'm not sure.
I'm calling in on the program.
Yes. So this is the Cinco Limited is doing a special call-in for our viewers and listeners. So you were listening to the program earlier?
Yes.
Okay, so go ahead, Ms. Piggott, repeat the questions and let's see if he can answer anyone. What's your name and where are you calling from?
Cleveland. Sumner calling from Tushin on the east bank of the Essequibo River.
Okay. Cleveland.
Nice. All right. So you just need to answer one of the two questions.
Yeah.
The first one, name one type of the Omron blood pressure monitor distributed by the Cinco Limited, or name one location other than the Cinco Limited where you can purchase an Omron blood pressure monitor.
The answer is the 5 series risk blood pressure monitor.
Wonderful.
Okay.
Correct.
All right. Thank you.
Correct.
Can you
So-
give us your full name, please, and a contact number?
Oh,
Okay.
You would have been the winner for one of our hampers. Hello?
Yes, my number?
Hello?
Yeah,
go
I'm listening.
ahead.
My telephone number is 502-3941. My correct name,
Okay, your name?
Cleveland, Cleveland. Sumra, Somrah.
Okay, so 502-3941.
Correct.
And
All right,
calling from
congratulations, Mr.
Tushin.
Cleveland. We'll call you shortly after the program.
Thank you. Bye-bye.
Thank you,
All right,
Chilla.
thanks for calling.
Okay, so that from the get-go, that means we are engaging our listeners. From the get-go, he got the answer.
Yes.
So we'll open the line again, and you'll repeat your question. And this is the second question. And you're talking about where the Omron blood pressure monitor, that is, right?
Yes.
Where another location besides the Cinco Limited that they can purchase that item. So our number you can call in 226-7453, and we have another caller on the line. Good afternoon.
Good afternoon.
Where are you calling from?
I call from Lamaha Park.
Lamaha Park. And what's your name, sir?
My name is Alfred Rogers.
Alfred Rogers. Hi, Mr. Rogers.
I can't answer the question without the location that you can pick up.
Okay.
I can't give you the answer to the location to complete it.
Yes,
Not
yes.
hearing anything. Hello?
Are you hearing?
Yeah.
Just hold. They're hearing you.
Hello? Hello?
Oh, go ahead. Go ahead.
They can get the machine to buy at one of Massive Pharmacy.
Miss Piggott, are you hearing? They're joining.
Massive Pharmacy.
I heard you, sir. It's the virtual, the Cinco representatives. Are you hearing me, Miss Piggott?
I'm hearing you.
Not you, sir.
Hi, hello? Hello?
Hello?
Yes.
Yes, good afternoon. Sorry about that. We just got a little bumped off. Okay, so Mr. Alfred, please name one location other than the Cinco Limited that you can purchase the Omron machine.
Massive Pharmacy.
Pardon me?
Massive.
One of
Yes,
Massive
correct. Can I have a contact number for you, please, Mr. Alfred?
686.
686
6072.
6072?
Yes.
All right, so 686 6072.
Yes.
All right.
All right, thank you very much. Congratulations. We'll contact you shortly after the show.
Okay.
All right, so that will be that. Thank you so much, sir, and those who listened. Thank you, Miss Piggott and Miss Lamb. It was a pleasure having you here on the show.
Thank you for having us.
I'm sure that
Thank you for having us.
the viewers and listeners got a little bit of treat this afternoon. I see they were excited to call in, and I'm glad that they participated and that you came on board to share about this kind of monitoring machine which people need when it comes to dealing with hypertension or high blood pressure. So this brings us to the end of our program for today. You were listening to Your Health Matters here on Kaieteur Radio. Thank you for joining us, those who joined via Facebook Live or via radio. Thank you for listening. Thank you for participating. And we'll see you on our next program, which is next Monday at 1 p.m. or 1:05 p.m. See you then. Be safe and take good care of yourself. Thank you. Bye-bye.
Thank you. Have a good afternoon, everyone. Bye.
You're constantly exposed to viruses and bacteria every day. That's why you should take Reduxin Double Action. Its formula of vitamin C plus zinc strengthens your body's defenses to fight diseases caused by virus, bacteria, and minor infections. Take Reduxin Double Action every day. It's from